So now we have dermal fillers or soft tissue fillers, and this is an amazing procedure. The substance in these injectable fillers is called hyaluronic acid. And hyaluronic acid is a non-reactive substance which can be injected in large volumes into the patient's face without causing a reaction. And so allergic reactions, infection, nodules, or any adverse effect are extremely rare. But this is the reason why this is becoming an increasingly popular procedure. The fillers are able to decrease wrinkles, they're able to decrease the depth of folds, they're able to build up the cheek, they're able to give one a better jawline, improve the lips. Obviously, you don't want to over puff up lips because that's unnatural. But so many improvements can be achieved in the face, lasting anywhere from 3 months to a year to 1.5 years, that this has become an exceedingly popular and pleasing procedure for our patients. So one of the problems with fillers today is that everybody is injecting fillers. You don't have to be a plastic surgeon or a dermatologist. There are many aesthetic physicians, they're nurses, they're nurse practitioners. And most of them are trained, but maybe not well trained or not experienced enough. And by injecting too much filler in certain areas, over puffing the lips, putting too much in the cheek, causing too much puffiness, fillers can get a bad name because people's faces can be altered too dramatically and become almost, and patients can become almost unrecognizable. So one has to be careful, conservative in how one administers the fillers. There are certain complications that occur which are extremely rare, and well-trained practitioners are able to avoid these complications. So fillers address many issues in the face. One may have deep circles under the eyes, which are hollow, and then filler in that area can give a remarkable improvement. One might have very thin lips. Fillers in the lips can enhance the lips and make them look more attractive. A lot of problems in the face as we age is descent of the tissues and flattening of the cheeks. So by injecting fillers deep into the cheeks, one is able to rebuild up the cheeks and give the face a lifted appearance. There are many areas of the face which can be improved. Hollowness in the temporal areas, a retrusive chin, one can rebuild up the chin. Deep folds along the sides of the mouth, going down to the jawline, those can be filled. Sometimes people have very deep nasolabial folds. Filling all these areas rejuvenate the face and give a more attractive appearance. So I'm quite passionate about the use of fillers. In fact, I've been involved in developing new filler materials and are very conscious of where enhancement of the face needs to occur safely and with long duration. The patients are going to be unhappy if the fillers go away because it can be quite expensive, especially when one is injecting multiple syringes to enhance an area of the face. The fillers keep improving, especially in terms of longevity and the ability to lift tissues. Also, fillers are made very thin so that they can be injected into superficial lines, into superficial wrinkles. My practice is extremely busy with fillers. Almost every patient is a candidate. One of the interesting things about fillers, if one returns to a doctor twice a year for 2 or 3 years, they seem to develop a permanent improvement. And often areas that before were augmented or filled don't need filling anymore. And I try to advise my patients that if they keep the process going, they maintain their appearance and their younger look, their rejuvenated appearance for years to come. So obviously one has to be an expert in how one injects fillers. Once again, the most common problem is that of bruising. So whenever we inject fillers, we have a nurse standing by the bedside applying ice and cold sponges to apply compression to areas which might bruise. So this is very important to take one's time to keep the patient in the office after they've injected the fillers with ice packs and with compression. And avoiding bruising is a significant aspect of the treatment. One's going to bruise every time one has fillers. The downtime can be up to 2 weeks with bruising, and the patients can be extremely unhappy. So this is a very important aspect, is how one administers the fillers. Also, one has to understand the anatomy in the face, understand where the vessels are, where to avoid getting bruising.